Welcome to eCareDiary.com's Caregiver Tips and Clips. I'm your host Meghna Giritar. Each week we will focus on a caregiving issue in the form of a short educational video. The subject of today's video is prostate cancer. Prostate cancer is a form of cancer that begins in the gland cells of the prostate, which is found only among males. The American Cancer Society predicts that around 220,000 new cases of prostate cancer would be diagnosed in 2015. An estimated 27,000 men will die of it. Prostate cancer is rare in men younger than 40, but the chance increases after the age of 50. About 6 in 10 cases of prostate cancer are found in men over the age of 65. It occurs more often among African American men and Caribbean men of African ancestry than among other races. African American men are also more than twice as likely to die of the disease as compared to Caucasian men. Prostate cancer occurs less often in Asian American and Hispanic or Latino men than in non-Hispanic whites. The reasons for these are not very clear as of now. There are some key risk factors that males should be aware of when it comes to being diagnosed with prostate cancer. This cancer seems to run in some families, which suggests that there might be a genetic factor involved. Having a father or brother with prostate cancer doubles the man's risk of developing the disease. Men who also eat a lot of red meat or high-fat dairy products appear to have a slightly higher chance. These are also men who might be having fewer fruits and vegetables in their diet. Being obese or very overweight is linked with a higher overall risk of getting this kind of cancer. Obese men have a lower risk of getting the low-grade form of the disease, but a higher risk of getting the more aggressive form of prostate cancer. There are no warning signs of early prostate cancer. Once the tumor causes the gland to swell, or once the cancer spreads beyond the prostate, the following symptoms may happen. A frequent need to urinate, especially at night, difficulty starting or stopping a stream of urine, leaking of urine when laughing, inability to urinate standing up, blood in the urine, deep pain or stiffness in the pelvis, lower back, ribs or upper thighs, loss of weight and appetite, fatigue, nausea or vomiting, weakness or paralysis in the lower limbs, often with constipation. Once the prostate cancer has been diagnosed and staged, there is a lot to discuss with your doctor to decide on an appropriate treatment plan. It is important to understand the questions you need to ask your doctor about prostate cancer and also be aware of the factors that need to be taken into consideration before you choose your treatment. Some of the important factors that play in this are age and expected lifespan, other serious health conditions that you might have, stage of your cancer, the likelihood that each type of treatment will cure your cancer, and your feelings about the side effects. Let's look at some of the important treatment options available when it comes to prostate cancer. One of the most important ones and the most common ones is surgery. The main type of surgery for prostate cancer is known as radical prostatectomy. In this, the surgeon removes the entire prostate gland, including some of the tissue around it. This can be done in different ways. There's also radiation therapy that uses high-energy rays or particles to kill cancer cells. Cryosurgery is sometimes used to treat early-stage prostate cancer by freezing it. Hormone therapy, which is also known as androgen suppression therapy, is focused on reducing levels of male hormones called androgens in the body to stop them from affecting prostate cancer cells. Chemotherapy is another treatment option that uses anti-cancer drugs which are injected into a vein or given by mouth. These drugs enter the bloodstream and go throughout the body, making it a very useful option for cancers that have spread to distant organs. Unlike traditional vaccines, prostate cancer vaccine boosts the immune system to get it to attack prostate cancer cells in the body. This method is used to treat advanced prostate cancer that is no longer responding to the other methods. September is Prostate Cancer Awareness Month. Resources for more information and support are available at the National Cancer Institute, the American Cancer Society, National Coalition for Cancer Survivorship, and the Prostrate Cancer Foundation. Thank you for joining us today. To access more caregiver tips and clips, visit us at www.ecarediary.com. Until next time.